And now we have two presentations that were on hormonal contraceptives and the links with HIV. The first is by Angela Crook from the MRC in London, who has done a beautiful secondary analysis of a large randomized trial of a microbicide and has been able to look really carefully at the effect of hormonal contraceptives on HIV risk. Angela?
Thank you, yes. So early last year, the WHO published a technical statement on hormonal contraception and HIV. And while there were some concerns about the progesterone-only injectable contribution may increase risk, evidence to date is inconclusive. So as Sharon's just said, MDP301 provided an opportunity to do a secondary data analysis on this microbicide trial data, which was an opportunity because data was collected on contraception every 4 weeks, and we were able to distinguish between NET-N and DMPA. So we found that women who were using progesterone-only DMPA had about between 30 and 40% increased risk of infection after adjusting for confounders that we were able to measure in the study. And we did not see this increased risk for women using the NET-N or the oral contraceptive group. Although just because we didn't observe an increased risk of infection does not confirm in this case that there's no risk. So the trial was not specifically designed to answer this question, so we can't rule out other possible explanations. For example, it is possible that women who choose to use DMPA were at higher risk of HIV acquisition due to unmeasurable risky behaviours. But we feel our findings do provide another important piece in the puzzle to try and understand the best ways forward to reduce women's risk of HIV, and these will be contributing to a much larger individual patient meta-analysis being led by Family Health International, which is due to report later this year.
Thanks so much, Angela. Mm-hmm. And then finally, Summer Day from the University of Washington is going to talk to us about the other side of the equation, whether or not hormonal contraceptives increase HIV shedding and spread to uninfected partners.
Yeah, thank you. So use of Depo-Provera, a form of injectable hormonal contraception, has been identified as a potential public health concern, as we've just heard, for the potential increased risk in transmission. However, most studies have not included women who are on antiretroviral therapy. So the question we wanted to answer was Depo-Provera likely to increase infectivity in women who are also on antiretroviral therapy? So we conducted a prospective cohort study measuring plasma and cervical HIV RNA levels in Kenyan women receiving antiretrovirals. 99 women were followed for almost 3 years with quarterly visits that measured plasma and cervical viral load, and showed overall they had low levels of detection at 15% in plasma and 6% in cervical secretions. And women were exposed to Depo at almost 20% of visits. Our analysis showed that compared to visits with no hormonal contraception exposure, there was no increase in plasma or cervical HIV detection at visits when women were on Depo-Provera. In other words, it was reassuring that Depo-Provera is unlikely to increase infectivity in women who are on effective ART. So following the publication of studies I've mentioned that Depo-Provera may increase transmission of HIV, there's been some discussion of limiting Depo-Provera use in women with HIV. This strategy could lead to increase on unplanned pregnancies, mother-to-child transmission, and maternal morbidity and mortality. With our results, we ask that people consider in this era of increasing ART for prevention, potentially initiating early ART in women who are also seeking hormonal contraception.